barn from. Let's do this. Oh, hi there. How's it going? I'm feeling like a queen today. Christine Hrudka's with us in the audience, way over there. We're going to formally introduce her later. But Christine, I haven't forgot about you. You get one too. And as I'm drinking from Jimmy Kimmel's cup, cheers to you. I got one for you as well. So next time we do get together physically, it's all yours. So, all right, I'm going to see if I can keep talking and the hat stays on my head. I tend to move around a lot. Welcome everybody to our 8th edition of our Thursday Live. We're really excited to have special guest Christine Hrudka joining us today. And it is another sunny day. So I'm really happy because yesterday I think we felt we were all going to be like coming to work in our canoes or maybe going for a walk in our canoes. I'm not sure. But anyways, it's going to be a wonderful 40 minutes with Christine. I've got a couple of things that we need to just get through. Of course, you that are listening in on Facebook Live, you do know that these will be posted to our website as well to our Facebook later. So please do share them with others that you feel that would see value in what we're offering today. We've had a great run. This again is our 8th edition, and we've had some really great speakers and some great content. And we're all pushing together through this whole COVID crisis. So thank you again for taking the time to join in. We also do want you to know that we do have a private Facebook. We do encourage, certainly our clients are on there, our preferred partners are on there, our HR and our disability management team, and we've got our wellness people. And so we have a lot of great input and peer input with this Facebook that we've created on a private peer level. So we do encourage you to come to us, ask questions. We'd love to have you on board because I know there's a lot of smart people out there and a lot that would really like to learn from other smart people. So please do inquire with us. We have next week, oh my gosh, I'm so excited. We've got Bryn Boback, the president and CFO of the Jim Pattison's Children's Hospital. She'll be joining us next Thursday live. And the Thursday after, we're having a lot of fun. So we're going to have Sylvia Martini. She's going to be our guest 2 weeks from now. So do mark that down in your calendars, and love to have you come on board and share with us and ask lots of questions. That's what this whole session is for. It's not for me just to talk, and Christine will have her join in very quickly. We'll be doing a lot of Q&A type of stuff, but we do encourage you as an audience to throw those questions back at us because that's part of us learning together as well. A couple of real quick noteworthy items. We all know, obviously, that phase 2 has been out there. Yesterday was yesterday? I'm going to introduce Colton. See, Colton. Colton. And we do this time have an official announcement. So he is officially on the board of directors for the Chambers of Commerce. So I think that was an excellent choice. Thank you, audience, for voting for him. So phase 2 yesterday was the opening of a lot of business on a retail level. And I know just in talking to a lot of our clients, there certainly is a lot of optimism, a lot of, I guess, a little bit skepticism as well, because there's just some challenges with opening up businesses. So I know on the one level, because it's kind of the one that seems to be top of mind a lot, was the dental side. So people, dental offices, thank you guys for going and pushing through all the different requirements and protocol that you need to open up your shop. I know that hasn't been easy. They are taking on patients, although they're going to have to go slow and steady because, of course, the inability to bring in as many patients as they'd like to is not there just for safety requirements, of course. So I know that some are also looking at having consent forms signed, that when you come in, there's really just about, again, trying to manage health on both sides. Just the consensus that, yes, I am good and I'm healthy. And so don't be alarmed if you're asked to sign that consent form when you do go see your dentist. We do have a couple of real subtle movements in the marketplace for benefits. We do see now that there are a few companies that are, again, giving a credit to your premium for the month of May. So when we first talked about this, we were talking about an April credit that would show up in a May or a June billing. Now some companies are offering another credit, and they might be the same, but it might be a little bit lower. It seems to be that for the most part, they're still working with around the 50% credit on the dental side. Maybe it's reduced a bit more on the health side. Maybe it's more like a 10% credit. And again, not every carrier has yet told us that this is what's going on. So if you have any questions, call us and we can let you know, because we do deal with the entire insurance marketplace. So we'll have a good eye on in terms of what's going on there. I do want to say, and I say thanks to Mike. He had brought that to my attention. That and Christine, I'm sure you're aware of this. That there is a service that's out there, and maybe some of you know about it and have heard about it, called 211 Saskatchewan. And I didn't realize how many things that they're doing. So it is a free. It's a confidential, it's a 24/7 service, and it connects you as an individual to human services in the province. It's telephone, text, that type of stuff, web chat. But there's over 5,000 listings of social, community, non-clinical health, and government services. That's a lot of support out there. So if there's anybody out there that hasn't got those resources with their own carrier through their EAP program and things such as that, then certainly I would suggest to reach out to 211 Saskatchewan, and they'd be there for you. A couple shout outs. We do have virtual care. We'll talk a little bit about that with Christine. Virtual care is moving, and it's there to stay. And a couple shout outs. I did mention last week that Haley from Warman Physiotherapy and Wellness Clinic, she has been doing telehealth. And so that's great. And we also have another client of ours, Mackie Physiotherapy. They're prepared to do telehealth as well on the physio side. So thank you to both of you for being there, support the community, because we all need to take care of ourselves. And we're going to get into that a little bit too as we go through. So I think that's all I need to add. Again, the phone lines, the questions are available to us throughout the presentation. If we can't get to them, or maybe it requires a little bit more in-depth conversation, it might be better that what we'll do is we'll source those questions and we'll bring them back to Christine to answer if we can't get through them in our session today. So, Christine, I know she sent me an official. Are you on there now, Christine?
I'm here. Good.
Where? Hello.
Good morning, Deb.
Good morning to you.
Thank you.
Are you feeling good?
I am. I'm feeling great. A little bit of rain, great for our farmers and our gardens. So exciting.
I know. Well, if I was one of those people that said that it makes me feel really refreshed to go plant gardens, I'd say I'd be happy. But I go to the farmer's market.
Well, I'm attempting to grow one this year. So we'll see if I can conquer the weeds. How's that?
You know what? Hats off to you. I mean, I'm working on just buckets of flowers right now. And I'm thinking if I can make those live through the summer, I'm off to the races.
Well, mine is going to be simple.
Well, then I'm going to come over and raid your garden sometime.
Yeah.
All right. Well, I want to formally introduce Christine. I know Christine has been around in the industry for many years and done lots of very important and critical, I think, movement with respect to the role that she plays in the pharmacy side. I actually and I know this wasn't your official bio, but I'm just going to kind of share, because I always thought this was the coolest, because I have a cool story too. So I think that's maybe we've been connected is when you shared that story. And I think it was one of the forums you did for WESC, I think is where I saw you, Christine. And you talked about your story about, when you first started out in business, a young gal in her 20s, and, had, this great vision to conquer the world. And then when the opportunity came along with the Shoppers Drug Mart, and you weren't on the list, let's just put it that way.
Yeah.
And I think that's what probably gave you like that, damn it, I'm going to do this, and I'm going to show you guys what I can actually do and what I'm capable of. So I say hats off to you for pushing through. I think that, especially in a day and age where it was difficult in your industry as a female to be able to push through some of those barriers. I think you set a great Example for many, many women that want to be professionals on any level and own their own businesses. So thank you for that. So she's got two hats that she's wearing today, Christine, and we want to kind of hear from both sets. She is an entrepreneur, and she does own a pharmacy called Pharmacy First. And so she's been on the front line of seeing all the stuff that's been going on in this chaos of COVID. But she also wears the hat of being the chair of the Canadian Pharmacistical Association. And that's pretty important. And I imagine a lot of conversations going on at this moment in time.
Yeah, absolutely. Lots of conversations nationally about, how to tackle COVID, and then of course just pharmacy in general and how it's changing our world.
Yep. Yep, exactly. And you've done many other things in between that. And I'm just going to, like, let me see here, Saskatchewan College of Pharmacy Professionals, the Pharmacy Association of Saskatchewan, obviously University of Saskatchewan Senate. So the list goes on and on. So you've got a lot of depth. And I think that's great that you can come and share that with our audiences. I think a lot of people don't realize these things that go on behind the scenes, and that when you're advocates to, the things that make for better community, I think we need to share more of those stories. So we'll go through a little bit of those things today when we're talking.
Sure.
Is there anything that you wanted me to share about the Canadian Pharmaceutical Association?
No, I think I can give a brief on that, Deb. We are an advocacy group, a national advocacy group, and advocate for pharmacy on a national level. So definitely, my job as chair for the last 2 years has been to go around the country, go to conferences, conventions, and speak about pharmacy. One of my passions was pharmacy, women in leadership. And
like
of
that.
course, that came to a dead halt March 13th when the COVID crisis hit. So sadly, I was going to do probably my biggest audience in Washington, D.C. on March 20th, talking about women in leadership. So that got canceled. So I was really upset. That was probably going to be my biggest audience I'd ever been able to speak to. So it's been definitely now all on phone.
Well, I'm going to send you that podcast, and we talked about that one I saw
Yes.
about that staging going virtual, and you know what? You're going to be able to bang it out of the park. You're just going to have to do it virtually.
Yeah.
But it's probably going to be, honestly, probably the advantage is you're going to have that many more people join in. That's my vision.
No, there's no doubt. You get a larger audience. Virtual is going to be the way it's at.
Yeah. So this COVID journey, I know my journey, and it's been kind of like, well, let's see if you can see on this, it waves, and we kind of flatten out, and then it kind of does this. What have you been seeing? What's your storyline on the COVID journey up to now?
Sure, thanks, Deb. And I kind of give you my, CPHA advocate hat, and I'm sure there's speakers all over who are listening in that are saying, "Oh my God, my world came to an end." And so, conferences, all of those things have ended. But I really want to give you a perspective from pharmacy right now. So literally a light switch came off and our health system closed down in Saskatchewan, and I'm in Saskatoon. Literally, there were no patients, and it became really quiet. My pharmacies are both in walk-in clinics. By a Monday morning, by 11 o'clock, we would have people sitting on the floor waiting to see physicians, and that changed to having absolutely zero, and I mean zero people in the waiting room. Basically, physicians all went home and started helping their patients virtually. All of our elderly patients, of course, who were at any kind of risk, stayed home. So the only way that we could get their prescriptions to them were being delivered. Of course, also what happened during that time is that we went on this huge surge of PPE, personal protective equipment. Pharmacies never ever needed masks or gloves or sanitizers or any of those things. So, I mean, there was just this, oh my God, how are we going to protect not each other, not just from our patients, but from all of us who work in the pharmacy. So, physicians all went home. We decided we've still got to be there, and we were. So our phones got crazy. We were really the only healthcare professional available for people to talk to. We installed plexiglass. We social distance to the people that were coming in. And oh man, we started sterilizing everything all day long. No more cash, all of those things. Meanwhile, out in the world, and I like to equate us, and you and I discussed this, is that toilet paper became the big thing. Well, so did drugs.
Yeah.
So our patients, by March 15th, everyone was in stockpiling drugs. And we had about a 300% increase of drug utilization across this country. And that was one of the reasons that I'm sure many of your benefits employees said, oh my God. So we decided across the country to limit that to a 30-day supply. Alongside with that wasn't just that people were coming in. Our wholesalers also cut back how many drugs we were getting. So we were having shorts, of course, shortages in our drug orders. So even if I wanted to order thousands of pills, I couldn't. So it was just a really crazy time to be in healthcare. And pharmacists all over this country, they would come home from work at night, throw their clothes all off, run for a shower, and there was huge fear at the beginning, just for getting COVID, bringing it home to their families, and of course, fear for our patients. So healthcare has never ever seen something like this before, and it was absolutely scary, really, what happened to our whole healthcare system.
Well, and because it happened so quickly, it was like there was no think time to this. It was just like bang, like you're in hot water, and it's like, I mean, fast. And I think that is already in itself the stressor, right? Because how quickly can a person pivot? And you're
Well,
always wondering, are you pivoting in time, and are you doing the things that you can be doing, right, to service the public?
that's exactly it. And patients, of course, people panic. And can you imagine going to a drugstore and not have there being no pills at all? That whole fear of a huge drug shortage across Canada was real. And I still, by the way, fear. We think we've got things managed, but just take something like a Ventolin inhaler. The reason it became short is because we started using it on patients. We have nebules that we'd use, and they became at a big risk of inhaling them. So everyone across the country moved to an inhaler. So things like that, antibiotics, anybody using a ventilator, all of those drugs became at huge risk. So it still worries me, to be really honest.
Well, and it's right because I read an article that you had written, and that was one of and I can see that, especially at this time of year, like with allergies, like a lot of people have a heightened, right,
Absolutely.
awareness
Asthma.
of what's going on around them, and I'm sure that they're feeling much more stressful, and that doesn't help them either. But there was arthritis is another one that came up, arthritis and lupus, and of my world. I mean, that's one of the top chronic illnesses is arthritis. So now you've got these people fearing. So when we talk about chronic illness in the benefit world, we say usually it's not just one chronic illness we're dealing with. It could be up to three. I mean, sometimes
Yeah.
people point to five, but there's three. And usually the secondary one becomes the mental health space. That is
Yeah.
another one that starts to peak in anxiety in today's world, on top of having their own illnesses that they're dealing with. It's got to be difficult, right?
Yeah. Yeah. Let's hope we've seen the worst of this. I'm not sure of that, to be honest.
So if we kind of look at, like, where do you see on the pharmaceutical side, like we measure and we see a lot of reporting on, obviously in benefits, we talk about drugs as one of the bigger pieces, the bigger costs to benefit programs, and it interlinks with everything else, right? The disability programs and the productivity and the health and wellness of our employees. But we know where we've been peaking in areas pre-COVID.
Yeah.
Um, where do you see it now? Has there been some shifting on some of the things that you've been seeing up to that point that are either going to turn and go a different direction or maybe increase?
Sure. Yeah. A brief, pharmacy and private payers, which is who, Deb, you represent. We have one common, and that's to an employer, it's their employee, and to us, it's our patients. And, sometimes benefits are something that employees don't even think about until they need them or till they might not be there. And, we're kind of the frontline drug plan manager for most of our patients. helping navigate them through, their drug plan. Interesting statistic, there's about 280 million spent a week on drugs in Canada. It's staggering.
Unbelievable.
And we're not really sure, are we getting the real benefits? So pre-COVID, there's definitely been a movement to move from just giving people drugs into a wellness space and trying to, help people prevent, right, having to take all these drugs. Biologics, as you know, Deb, hugely expensive,
Huge.
eating up, big parts of drug plan managers' benefit drug purchases. So lots of pressure on drug costs, lots of shifting, starting into the wellness space, into prevention. COVID hits, and again, what's the first thing that we see is this huge stockpiling. So that was why we went down to a 30-day supply across Canada. Now those are getting relaxed right now as we feel we've got some control, but who knows where that will end. I do believe, and this is, I think, the whole part post-COVID is anxiety and depression that people are facing due to isolation, anxiety created by fear. So an interesting statistic, in the last 5 years, antidepressant use has doubled. I will be very interested to see what's going to happen with it post-COVID, and how people are going to deal with all of the issues, right, that they're going to have mental health wise. So, post COVID, we've definitely had these limits on drugs. Seniors haven't been happy because of course, larger fees. And absolutely, post COVID has gone virtual care. And I think that all drug plan managers are going to need to have some kind of virtual care as part of their platform. And I think, Deb, you have looked in, you are providing that for your benefit managers, right?
And our insurers moving quickly. Everybody's moving quickly.
Maybe talk a little bit about that, because I think that is going to be the future. I always say that we've been working on virtual healthcare for probably the last 2 years, but what was probably going to take 10 years has happened in 2 months. So, so maybe speak a bit about that platform, Deb.
Yeah, well, no, and I'm glad, because we're totally on the same page. And when I had Matt Brady, who is our provider for our telemedicine, we know there's a lot of insurers that are providing an opportunity to jump on board and then embed it back in at a cost when things settle down. We know that Lumica in Saskatchewan is doing a job to try and manage it. So there's a little bit of that everywhere, but we needed to still fill a gap in terms of what we wanted to reach out to our patients. If they couldn't get on board with Lumica in a timely fashion, at least we know that we have an avenue that they can go down. And you raised a lot of great points, because yes, telemedicine, we say that time and time again. I mean, we know that that's here to stay. Always excited when our practitioners, our physiotherapists and chiropractors and now massage, all those people can get back on board. And yes, it looks a little bit different, but I think in my world, and we've always been really in tune with that whole wellness, that whole preventative. And so we've always, our motto really is working towards a healthier bottom line. And that works in every pocket. It's not just as it relates to the price tag or the HR or the man. They all work together, and big space that we've always been into is wellness. When you talk about, stats and biologic drugs, I mean, most of the chronic illnesses are treated with biologic drugs that can get into the thousands. And now when you speak to the fact that someone loses a benefit program, it creates a problem. Like, where do we get that care? And so I really would like to think that, the good that comes out of this is, to your very point, Christine, is we are going to have to be, we need to be, we would want to be more in tune with our own well-being, what's going on. And I'm not saying every day we're feeling awesome, because we're not, but we have to work on the tools. When they say that, like diabetes is 80, like type 2 diabetes, and correct me if I'm wrong on my stat, but they say it's 90% preventable.
Absolutely.
I mean, that was a conversation a few years back. I mean, we talk about the things that were preventable if we were better at managing these things. And here we are, we're forced to make some really big decisions, important decisions, because
Yeah.
COVID's not going away. It's here to stay for a little while. And we'll speak to, your predictions, but we need to get a handle on how we can better maintain our own health. And that's going to be, I think, a challenge, but a welcoming challenge. That's what I
Yeah.
really believe. It's going to be a welcoming challenge.
Absolutely. And the virtual, it's going to be one thing to do a virtual to see your physician, a virtual to chat with your pharmacist, some of the services, med reconciliation, all of those things. But I also see, of course, speaking to a counselor. All of that is going to go virtual. Any, health, basic mental health is going to
Yeah,
go totally virtual. Add that to physiotherapy. You can do a virtual online physiotherapist now. And even, let's be honest, gyms where you used to go to spin class, you're going to be everything. All of those things, I believe, are going to absolutely pivot to virtual. We're going to be able to learn to play guitar. People like me might learn to cook and
right.
and speak other languages. I really believe that is going to be a big pivot in our world out of COVID.
Yeah. No, and I agree, because I know that for myself, you know what, I'm looking into that. What is it I want to do if I had nothing else to do?
Yeah,
Right. And so I challenge myself to those when we get there, But what do I want to do? But or make time for it. Right. And
right.
I think that, the ability to maybe use that as the wellness feature, right? Whatever takes your mind off of whatever stresses you. I think that will be really important. And I know for myself, I know that, like, we don't have to get overcomplicated with this stuff, because I think we do, we sink ourselves. We,
Yeah,
we just think, you know what, I
absolutely.
can't do that. I can't go there, right? It's no different than that bad word diet. Like, you can't go down that, because you always have to have those baby steps that give you hope. And I know even yesterday I was talking about, me and how I kind of getting overworked a little bit lately. And I was talking to someone, and sadly, and I think you even said it too, I came twice yesterday. Do
Yeah.
you eat, do you eat salt? Right? Do you eat salt in your diet? And I went, well, not really. I mean, yeah, well, I guess I eat 3 or 4 bacon in a week. I'm gonna cut the bacon, cut the bacon out, cut the salt out. I mean, simple. And I mean, I can do that. I can do
Yeah.
that if it helps just kind of relax me a little bit more, maybe drink more water. And another one important one that came yesterday is, like, you know what? Do 20 to 30 minutes of walking every day. We do have time now to do that.
Yeah,
And that in
absolutely.
itself will be very important. So what we hope, not that we want to take the pharmacists out of business, but we hope we can manage these things
Yeah,
so that you guys are only treating what needs to be treated, I think, in the best way possible. And
absolutely.
for the betterment of the whole community on the long term, right? So we talk about, kind of like, I think I call that the Cinderella story. I think that, through all of this, this craziness, that we've got something that we can be thinking about that would be creating that optimism. We talk about, the mental well-being space. Is there things that you would say that, would add to, what it is we need to do to get better on that? Because I think the one big one that it's not, depression, absolutely. But I think the starting is, that it's the stress that moves to the anxiety, that
Yeah.
moves to the depression. And so what can we do better to master maybe some of those earlier steps that we may not have already talked about, Christine?
I think that the world all of a sudden has become a germaphobe, right? And I think it's going to take a long time till we get a vaccine that people are really going to feel a lot less stress and anxiety from the current situation. So, but definitely, Deb, you spoke of some of the things, but I think that people need to start to feel safe in our world and safe to go outside. So I think that that's got to be a center of everything that we do in the next short while is making people feel safe. And however that's with PPE, wearing masks when you go out, washing your hands, washing your hands, washing your hands. And that's going to start to decrease the level of anxiety. And of course, there's financial stress here that goes along with this. And governments are trying to help with that financial stress. And I feel they've done a fairly decent job, but that it's short term. So I really believe this is going to be an absolute challenge for drug plan managers, for pharmacists, for all of us, for the next, unforeseeable future, really.
What is your prediction? When do you think they'll come up with a vaccine?
That isn't my predictions question.
You want to
I'm
leave that to
really
the
hoping.
last? Maybe I should. I'm going to leave it to the last
You
because I
can
have
leave it
one
to the
other question.
last, exactly.
I want to ask one other question because we talk about drugs and we're shifting a bit, but medical cannabis. When we talk about like what we're going to be having to do and traditional medicine, we know that medical cannabis was legal a few years already, but there's push into that medical cannabis space. Do you see something changing there? Something shifting there?
I do. I think, it's been a really interesting journey, medical cannabis. It started, it's by mail order right now, which allows you to distance. Then recreational became legal. But I really believe the medical cannabis space is going to take off, and that's sleep, anxiety, just the oils, the edibles that people are going to go down the road of. The whole medical cannabis is also pivoting. We were basically they were vaping product, and now it is definitely going into the edible space where the medicinal products are going to be in edibles, and probably even after that, they're going to go into capsules. So I think it's a brand new frontier, and I think there's research, lots of it, going on right now to move us into that space. It's not going to be for everyone, but I think it'll be definitely a tool in our toolbox to help people deal with anxiety. Interesting, the whole vaping has kind of become under a lot of pressure with COVID because again, it's something that's going in your mouth. So
Yeah.
there's really been a pivot in the medical cannabis space of vaping leaf products into now definitely more edibles, oils, and I think we'll end up in a capsule formulation.
Yeah. Well, and I think, if it, especially like I think about what's going on right now, and if there was a way in which you can, on a more natural level,
Yeah,
manage what's happening, if we've got this increased anxiety going on, if we can be thinking about, reaching out into that space and to be maybe a little bit more comfortable, because I do agree. I mean, they've been years in the research. There's lots of great stories that will tell you that there is a place for it. I'm really appreciative of the traditional, healthcare practitioners that are working in a holistic space as well to say, what can
yeah,
we do? How do we do this better together? And you and I know one of the, a couple of the same companies that are working really, really hard to create that space on the medical cannabis side, and until they can, come forward, because unfortunately the studies and the data is
the
going to have to
research. Yeah,
prove. Sometimes common sense seems to kind of go out the window, but if we can get the data that says this is going to be in the space that we have, this world that we have right now, and it's a good thing. I think I'm really optimistic about that. I think that I think it's been there all the time. It's kind of like telemedicine. It's
yeah,
been there for a very long time, but something has had to really move it forward and to get people to take a step back and to not have that fear, or that social kind of perspective on
yeah,
it, right? And I know that, and you probably know many more, and I love to continue conversations because I love when I hear about those people that are really studying it and really making it their practice on a professional level to treat people and monitor and help people, no different than the doctors and the nurses and the pharmacists of
yeah.
today, right?
Absolutely. No, I think it's a brand new area, but I agree with you, Deb. This COVID-19 is going to make hurry along some of the research that we need. A really interesting fact is that there is such a huge placebo effect of medical cannabis that lots of the studies, the placebo sometimes does as much as the real. So it's a very interesting drug, if I could say it that way. So, but a lot of Saskatchewan, right here in Saskatchewan, research going on, and I think it will move along a lot faster. I'd love to see medical cannabis come through pharmacies where we can look at your profile and see what other things you're on, and also give some healthcare oversight into using it. So That's the future. Hopefully it will come sooner than later.
Yeah. No, and I agree. And I mean, I'm looking at what we see right now, and I mean, we can potentially move some of the stuff that's happening, the product selling behind the scenes, push it forward, and make it a very uncomfortable with this, and I'm okay with it. And when you get the right people at the head of this journey and managing that person's health, then I think that adds a lot of credibility to it, of course, right? Rather than
Absolutely.
trial and error. Like everything's about trial and error. We know that. Like in my world, we deal with trial medications all the time. And you and I talked actually a little bit about cost of drugs and what's happening. And it was like, holy man, like we didn't, when you think about the amount of money that gets lost in drug wastage, right? With trial medications, you guys probably see it all the time, I'm sure. So when this
All
whole
the
90
time.
went to 30-day, it's not like this was like a real shocker to you, because you probably would like to have seen some of those 90 days go to 30 days just for the sake of saving money due to waste, correct?
Absolutely. Medicine cleanup. Oh my God. You should see it. We get buckets and buckets of drugs returned. It's heartbreaking, really, about how much wastage there really is. People start on a drug, they don't like it, they don't like the way they feel, and quit taking it. And there is so much wastage, Deb, that it's astonishing, really.
Yeah. And I think maybe one of the things that we could, hopefully see, because I've always, and I get it, like people, to your point, people stop taking it. Maybe they feel better.
Yeah.
Maybe they think they're better.
Yeah.
But maybe they feel really bad and they're going, oh my gosh, it's the drug that's doing that. I'm throwing it away and I'm not using it anymore. So
Yeah.
either way, it's not right. But I
Yeah.
think if we could see, maybe a better footprint and a go forward is, and we understand that, that the healthcare is already stressed, and the ability to care for our patients. They say on average, I know I've heard this from, Leon and Gary at Bridges, is that they say the average time that you get to spend with a doctor is about 7 minutes if you're lucky, right?
Yeah.
And so at the end of the day, what kind of care are they able to give you? Like this is pretty tough. That's a tough job. So if we can move into that space of maybe, on a wellness level, more health coaching,
Yeah.
and I wish I could remember the gal. I know you probably would know her if I brought up her name. And she'd done a presentation. She was like a patient advocate when it came to the trial medications. And she was there to do kind of like a clinical study, to be there to coach these people, to know what we need to do to get them, push them through this thing, and to give them, because a patient takes drugs, they don't know what's going on. But if you're there to say, it's okay, this is going to be what it's going to be for 24 hours, and you know what,
Yeah.
you'll get through this, you'll go, whew, okay, that's good, right? But if you don't have that health coaching, that's a pretty big unknown and uncertainty, added stressor, right, to someone's
Absolutely.
care.
Yeah.
So
They say success of smoking cessation is totally increased by 80% if you have a coach. So
really,
kudos to all those coaches out there.
Yeah. Yeah. Well, and I always say sometimes it's nice to send people with a little bit of money. So we always say in the group benefits, of course, we carry sensation products, and the ability to stop smoking. But sometimes I think the incentive is if you can quit smoking for a year and you collect all your bills and you bring them to me, there's incentive in that part too, right? So, and once you get past a few months, but it'll be, when you think about health in today's world and COVID, I mean, those people might be thinking twice, hopefully.
Absolutely.
Thinking twice, because smokers are high risk when it comes to COVID. So if you were to do something good for yourself, you'll be looking at the means in which you can quit, get the buddy system, whatever it takes, right? To do it.
For sure. Diabetes, high blood pressure, smoking are all risks in the COVID world, for sure.
Yeah, yeah, exactly. So, so if we were to, is there any questions, Colt? We're good?
No questions right now. From a bit earlier, there was a comment just from Rob McGuire saying, "Greetings, Christine. Nice to see you." So that was
Hi, Rob.
Oh, there we go.
He's an Ontario boy.
Oh, really?
Yeah.
Okay. Good to hear. So I'm thinking of a few other things because I've got a couple minutes. Future of business for the pharmaceutical world. What do you see that looking like?
Yeah, interesting, Deb. First, maybe I'll do my predictions, and that might just kind of open up that.
Okay.
I'm really, really hopeful about the future. One really interesting thing is that Canada and United States, this continent, we are creators, we are innovators. Unlike countries like China, they're makers, right? So we create the ideas, then we send it over there and then they make it. So there's billions, and I mean billions of dollars being spent right now in finding a vaccine and finding drugs that are going to treat COVID. So I'm hopeful about the future here. First of all, I think we will find drugs that if you do get COVID, you do end up in the hospital, that will be able to help you there. Secondly, I believe a vaccine is within 6 to 12 months. So that is because we are spending billions, it is billions of dollars right now across Canada, across United States to find a vaccine. And even this morning, I read that there's one that's approved in Canada out of Dalhousie. So I don't think there'll be one vaccine. I think we're going to try a whole bunch of things. There's going to be ones that have antibodies that they'll inject you with antibodies and see what happens. So I think that, that's going to help take the real pressure and stress off of all of us about getting COVID-19. So I'm really, really, really hopeful. I think the second thing that's going to happen is that Canada is going to start to say, man, we need to have control of our own PPE. We need to make it here. We don't want to be worried about buying it from China. And I think that's going to really change how things happen, including sanitizers, including all of the things that we've said, oh my God, we had no idea that this was all getting made, somewhere else.
Yeah.
I want to pivot that to drugs. And sadly, over the years, we have no drug manufacturing anymore in Canada. We've just left it all to China and India. They literally have 80% of our ingredients. So we do no manufacturing here or really in United States. So we're so reliant on China and India for our drug supply. So I am really hoping that is going to be a spur of our government. And I'm sitting on that COVID supply committee saying, look, we need to make this stuff, at least in North America and in Canada. There is no reason we cannot make our own masks and all PPE here right at home. And then I guess that pivots to just let's support local businesses. I think there's going to be this huge awareness of we need to support each other here. And sadly, that isn't Amazon. It isn't. It is buying from local producers, local suppliers like you. We need to help and lift each other up over the COVID. And I think nothing has made that more aware to any of us than this experience. So I hope to see many more things manufactured, sourced out in Canada. Interesting, BC supplies lots of the raw materials for masks right now, then sends it to China. It's crazy. Yeah. So we just let go that whole manufacturing sector. So those are some of those kind of predictions. To your point, Deb, I think there'll be a huge healthcare reform. Our system's a bit broken. People are no longer going to wait in waiting rooms to see their doctor, their dentist, to see any of us. And that's going to get enabled by technology. And so we're going to be able to the doctor will see you now and you'll walk in the door. I think we'll be able to much better plan when we see healthcare. How's that? Instead of this kind of waiting and sitting on the floor waiting to see a physician, telemedicine, pharmacy services, all of those things we're going to have to absolutely change how we do them. And then I think that, flu, I think, right now, sadly enough, in Saskatchewan, we only vaccinate 30% of our population for the flu. That's not enough. And I think there'll become so much of a larger awareness of how important it is to get the flu vaccination. Because so this fall, I'm expecting crazy crazy people wanting to get vaccinated. And I hope we get to see that. It truly makes no sense that we don't have a higher vaccination rate. So that I think is going to really change. And so if we get the flu vaccine, the COVID vaccine, which I truly hope everyone who's listening will go and get both of those things. I think there's going to be lots of testing. Not now we're COVID testing, but there's going to be testing for antibodies. I think we're going to see rapid COVID testing that you can do and get your results right away. And I think we're seeing that right now in Saskatchewan. We're going to start to do preventative testing. So even if you don't have any symptoms, but you're going to the hospital, you want to go see your parents, we're going to do testing for that. I think we're going to test to even go on a date. Thank God I'm not in that space right now, but I think all of it.
Get me really serious.
Yeah, absolutely. You're going to be, have you COVID tested before?
It'll be like that list of 1 to 10. Have you had the COVID test lately?
Exactly. So that's going to be, but these are all going to be business opportunities that are going to be out there. I think another interesting is going to be, and I do want to touch a bit about long-term care. Saskatchewan, we've been really lucky. We haven't really got hit in our long-term care homes, thank goodness. Ontario and Quebec, it's been devastating. And one of the reasons, and so I asked the question to Scott Livingstone, who is head of our health region. I said, why is it so different? And he said, in Quebec and Ontario, some of their long-term care homes have got one washroom for a whole floor.
Wow.
Yeah, old facilities. So when you're looking at why this is happening there and you see these huge numbers, that's one thing to think about. In Saskatchewan, we might have 2 people sharing a washroom. So our facilities are much newer, but there's still lots of work to be done. But I think there's going to be a huge movement, Deb, in business for keeping people in their homes longer, so that you don't have some of the issues that come. And let's be honest, flu can literally infect a whole long-term care home right now. In pharmacy, we service long-term care homes. We would have this huge outbreak of flu, and that wasn't, it happens. So I think that it's going to be, people will want to stay in their homes longer. And so there's going to be really opportunities for people to service that model. In all ways, including renovations. And I know this has got nothing to do with drug benefits, but that's, one of my predictors. And my last one is that, again, is that your prevention, there's going to comes incentives with employee plans. So if you lose 10 pounds, maybe you get a gift card for, a gym, and all of these whole wellness things are maybe there'll become extra premiums if you do smoke, or if you do bad things. And if you do good things, maybe, there'll be rewards. So I think that's something, Deb, that you're going to see in your world a lot. And I guess my last prediction would be, is that, right now, up to this point, when governments sit down and say, what are we going to spend our money on? They would say, do we need new roads or defense or spend money on tourism? I don't think we ever realized the impact that health has on our whole world and on our economy. And so I think that there's going to be a total shift in thinking about how health affects economies.
Well, think about
how health is wealth.
Yeah.
And so that is going to be, we're going to spend a lot more money on keeping us healthy and safe in our very own world. So, all of those attitudes are going to change. So I'm excited. I'm excited for the future. I really am. And I'm very hopeful that we will get through this. We're going to live with this. And people like yourself are going to pivot on what you see people need.
And you know what the good news is that it's already been there. but it's now to a new level. Like, I mean, you've made some excellent points. Like, I mean, we're fighting this, it's kind of like we're saying, and one thing out of one side of the hat and the other, because we want to live a long, healthy life. But you think about what we're doing to live a long, healthy life. We're not doing some of the things that we're supposed to do to live a long, healthy life. So we can stay at home and be that 103-year-old healthy person that walks to get their mail every day or whatever it might be. So I think it's really going to get people refocusing. I mean, 25 years ago when we started talking about rolling this into benefits and having these wellness partners, we call them, which again, shout out to Bruce's and to Trax Footwear and to Sangsters. Like, there's good places out there that are really trying to make that difference, right? And I'm thinking, we've been trying to work that space for a very long time, but this will really push it forward, I think, in a much more meaningful way. And, the last thing is, well, when you think about back in the day, I mean, when they made Canada Pension and 65 was the age, they really, their prediction, their math said that we don't think that many people are going to make it to 65. Because that's why they can make 65 the date. Well, here's these people, we're living into our 80s. But sometimes we're not living very healthy into our 80s. And so let's try and push that thing back into a space that we can work with it smarter. So I'm not saying we all want to live to 125, but if I do, I want to be healthy.
Yeah, absolutely.
I don't want to be in a home. I don't, right?
Yeah, so, I think there's total change of attitude about the whole health space, and total change about how lucky we are. We live in this country. Canada's done an amazing job at fighting COVID. Really, we have nothing compared to other countries in Europe, and I think we're going to change our attitude about how wonderful our country is. And it's I'm excited about it. One thing, when I traveled to Croatia, they only support their local wines and their local cheeses, and it's something we've really got to start to think about.
I agree.
Make everyone around us healthy, and that's through financial viability. So I think there's some really big lessons, Deb, and I'm there's gonna be some headwinds as we get through this. My prediction on the second wave, as we call it, we've learned lots. I do worry about all the people that have not looked after themselves over the last few months, haven't gone to see doctors, haven't got tests, chronic care patients that need, help. So I'm hoping that, there's going to be blood pressure management, lots of those kind of services that are going to pop up because people need them. And but I hope that with all the steps that we're taking to become more social distanced, that our second wave will not be so bad. Sadly, we don't live in a real warm country, and we do have to be indoors, and that makes the social distancing so much more important.
Yeah, exactly. We have two questions, so I don't want. I think two to come.
One
or
comment.
One? Okay.
Julian just saying, couldn't agree more. Our economy will shift our thinking. I think that's in regards to shopping local and such. So
yes.
We agree, Julian. And one from Mike. I'm going to put up the screen. Okay. But Deb, you could read it out there too.
Oh, okay. So Michael's asking, what's your take on U.S. plans to import cheaper drugs from Canada and threaten our supply? Is that a real threat?
I don't think that's a real threat at all. I think it's a lot of, I hate to say it, fake news. I've been, prior to COVID, in many meetings where we've talked about this. I think that, there's no way that Canada will be shipping our cheaper generics. I think the whole drug supply is going to come under huge scrutiny. We're going to really look at it. There's no reason we can't make generics here in Canada. We used to. And I think that will be one of the learnings that will happen. Imagine how you cripple a country, and that is by ending our drug supply. And I think we've become very aware of that. And I think that, but there was, things like insulin were a lot cheaper here, and Americans were coming up and buying it. But there was no way in our discussions with the federal government that we were ever going to ship drugs to the United States. But there was a lot of talk about it.
Well, and you were on, you had a good point when you were talking within your predictions, because I mean, I get why we've moved into spaces and getting China to do, to do our masks, or it's cheaper to buy our product from, the States, but we lose control. Like we lose
Absolutely.
control. So then all of a sudden it's like, now we have no choice in the matter. And so I always think of Paul Martin and one of his talks, and he talks about, how we would produce the grow the crops, produce the bird seed, send it across the world. Yep. And it came back to us to sell on our shelves for 3 times the price. He says, why can't we be doing that right here in our own backyard? And instead of working on the best deal today, what's the better for Canada on the long term? Yeah. So maybe it means an influx of a little bit more cost today, but then we've got that control. So we're not at the mercy of whatever someone else wants to do to control us, right?
Yeah, we may need to pay a bit more, but it is, and I think we all have to think about that. We may need to pay more for things, but you become so aware of how important it is to have our own, just our own supply, even of food, healthy food is so important. And, I think there's going to be a huge attitudinal change out there, and we need to keep talking about it so that we do change attitudes about local business.
Yeah, absolutely. And I look at, and I'm thinking of a couple more partners of mine, and Just For You Day Spa. I mean, I was impressed, and I said, you know what, the great optimism. And she's doing her, her little bit of her Facebook chats. She opens up, they're wearing colorful masks. This is what we're doing, and we're there to take care of you. We need to make sure their businesses stay alive so that they can still move in the economy and keep and keep our whole community robust. And I think of a good friend, Joy. She just opened up her shop downtown. I'm sure you maybe even shopped there. The biggest challenge ever. Like, take her situation, going, Debbie, in theory, that sounds great. I can open, but here's my challenges. And hats off to her for overcoming them. And, and then playing into a space that just works and have to do it slow. Maybe the dental offices, and we talked and 25, 30% of dental offices may not open or may not open till later. But we have to continue to support each other as a community so that we can get back to, I think, a better normal. How's that?
I agree.
Want a new normal. I want a better normal.
Absolutely. And this summer, as you're thinking, support our local hotels, support our local restaurants.
Do staycations, right?
Do staycations.
Bank and do a night over.
Absolutely. Yep. Go to Waskesiu. Go support our local economy. There's never, ever been a time when we need to do that more because everyone needs each other to lift each other up. And love Canada, I say, and love good old Saskatchewan. And we are a pretty safe place here, by the way. It's safe.
Absolutely. Well, and we have space. I mean, we have the space to enjoy and embrace, right? And they say, I was talking to a colleague the other day, and he said, among a few companies, of course, but they're shooting the lights out in business when it comes to selling hot tubs. So they said they're actually, as a client of his got, it's like 3 semi-loads of hot tubs ready to go. Because why? People are working, they're spending more time in their backyards and back in Saskatoon. And greenhouses. Right. Yeah. And so you go, and I know I've had some businesses that are in the retail or in the food industry, and they said, you know what, we've just been able to pivot quick enough and provide a level of service that our takeout services are doing pretty darn good. And we can balance this thing. We can still have our outside deck when things get rolling. But I also know there's now a space here for me to be able to do business and to be able to thrive on it. So it's a different way of thinking. And I think if we all work together. So I think on that note, I know that we're probably, we're at the end. I could talk forever with you. I know.
Yeah, no, we could go on forever for sure.
I know. So our therapeutic remedy is that glass of wine on the first deck that opens on a social distance level.
It's got your name on it, and we will hopefully see each other this summer on a deck for sure.
Absolutely.
Thanks so much, Deb, for having me.
Well, thank you, Christine. I think you gave some great insight, and you know what? There's some serious notes that we have to work with here, but there's also some optimism. And I think what we need to do is we have to take a breath, take a step back, and then we just got to work this together. And I think we're going to come out. I know we're going to come out thriving and be a better society. So thank you for all the work that you do in your world and the support you give the pharmacy and the healthcare sector. I mean, we couldn't be here without you guys. And thank you for supporting our business and knowing the importance of what we do and how we work together. because this is what this is. I mean, when I talk about partnerships, it's partnerships on every level.
Yeah,
and I think that just what makes it happen that much faster and that much better. So thank you again, Christine, for coming out.
Thanks,
and
Deb,
Christine,
for what you do. Thanks,
yes, and Christine is going to be speaking again at 3. I might be a few weeks following you, but Christine's going to be on West this afternoon.
Yeah, I am on West. Yeah, speaking about more business and drugs, but yeah, business opportunities, and some of it I've hit here, and I've got some other opportunities coming for that one. So
awesome. Well, I'm listening in. Okay, wonderful. Thank you, Christine. Have an awesome day.
Thanks for tuning in.
Thanks. Bye-bye. Thank you, everybody. Have a great day and stay optimistic.
Yes.